All right, all right. Folks, if you could make your way back to your seats. If you could make your way back to your seats, we have a couple announcements. If you could make it back to your seats, we greatly appreciate it so we can keep moving forward. I know there's some buzz in the air, there's some excitement in the air. Come on. That's it. Ladies and gentlemen, and boys and girls and children of all ages, if you want to celebrate recovery, make some noise. Let's let Boston know that recovery is real. All right, all right. If you haven't seen it, there's some wonderful food trucks behind you. We will be calling out lunch tickets and times. They're not going to be serving lunch when you want. They're going to be doing it according to the agenda, so we appreciate you guys. If we call out a color, if you would make your way to whichever box truck you feel is going to fill your hunger needs. But please wait for the announcement and know that they're not selling food. If you have a voucher hanging around your neck with a lanyard, that's going to be your lunch ticket. When we call out the colors, please make your way to the food trucks. Hey, if you want to eat, you want to hear this. Also, just a reminder, folks, for those of you that want to smoke and want to have your cigarettes, please, if you could take it as far back as possible, we would greatly appreciate that because some of us don't smoke. And this is a state park, and you're not supposed to smoke here. So if you would, please take it as far back away as possible. I would say take it off the field, off the park, because it's not supposed to be on the park. But I'm just asking that you take it as far away as possible. And even those that are vaping, vapors, can you hear me? If you feel like vaping, please take the same diligence to move away from the audience here. Please take it away from the crowd, because not everybody's vaping either. So please respect that. And we got some great people in the house. We got some great people that respect the rules, and we appreciate you doing that. Also, a reminder, I'm seeing vape coming from the audience back there. Yo, I'm talking to you right now. If you're vaping, please get up and walk away from the crowd. Please be respectful. I just talked about respect. Come on. If you need to use the restrooms, the restrooms are along the fence. I also want to make you guys aware, if you haven't taken advantage of it yet, there's different providers over there. They're providing resources, information. But I don't know if I forgot to mention this. There's this great artist over here, and she's painting as the day's going forward. If you haven't taken an opportunity to go by and check out what she's painting, you know, every now and then, if you want to pop over there and come check her out, come see what she's painting. Because by the end of the day, what we're going to do is, if you have a lanyard hanging around your neck, there's a ticket on there. And some of the artwork that she paints today is going to be given out as far as a giveaway. So you might be able to walk away with that artwork today that she's putting her hard work into. All right? Also, folks, these are just some housekeeping rules. Please be careful walking around the park. There are some divots in the grass. You might hit one. We don't want people to get hurt. So please just be mindful of where you're going, where you're walking, where you're stepping. Last one. Is it hot out today? Is it hot out today? All right. Right next to the swag table, there's some H2O. There's some water. Please make sure you avail yourself of some water so that you get hydrated, please. It is hot. We don't want nobody passing out due to too much heat. So if you feel thirsty and you want to wet your whistle, please make your way to get some water. right, all right. Good afternoon. Oh, it's not afternoon yet. Good morning. Before we continue on, I'm going to call out a number. And everybody that has a lanyard, a ticket in their lanyard. And we have
Namaste Sober.
Namaste Sober here. They have a basket of some goodies. So everybody got a lanyard, has a ticket behind that lanyard. I don't know what lanyard, what ticket. I'm just going to reach in here. I'm shuffling this. And I'm just going to call out a number. Now, somebody asked me to sing out the winner. All right. So I'm going to go ahead and sing out these numbers. I'm going to do this real quick. 484 288. So if the last three numbers is 288, please make your way here, right now. We'll leave the basket right here, and if they come up, you know. I'm gonna leave the ticket right here. No, not. We're gonna do it throughout. Nobody came yet. All right, folks. I'm gonna read these numbers one more time. Yep. 484 288. Come on out here. Come on out here. What's your name?
Angela.
All right, let's congratulate Angela. Let's go. All right, congratulations, Angela. All right. So we're going to go ahead and move forward with this. Before we move forward, I need everybody's attention because this is something that we do, and it's something that's very important. Folks, can I have your attention, please? Folks near and folks far. I see your hand. Yeah, all right, all right, we're good. At this moment, I want to take a moment of silence. If you can hear my voice, we want to take a moment of silence. We want to take a moment of silence to recognize a gentleman that was a great representation to the recovery community, first and foremost. But he was also a good husband and a good friend. We want to take a moment of silence, first and foremost, for Dennis Gonzalez. Thank you. For all of us that know a friend, a family member, someone that has lost their life due to addiction, whisper their name. If they meant something to you, whisper their name. The memories of those that we've lost stay alive when we do that, when we mention their names. Our friends, our family, our loved ones. Their memory lives on. Thank you. I'd like to take this opportunity to invite the Nipmuc Nation to please come.
Aho, Aquani Natasawas Menikisu Masmata, Manatu Katabotamashu, Kisa Kwak on Egan, Nupianta, Maskisa Kalkish, Nuichi, woman in the missing wall. You can't hear me? I need you guys to yell one thing. I'm going to say we do, and you're going to yell recover. You ready? We do. We do. We do. Okay, there's that energy right there that we're looking for. Give yourself a warm welcome and an applause for being here and being alive still. I want to speak on the land that we're at right now is the Massachusetts territory, and they're still here, they're still alive. The Ponkapog, the Titikit, and the Namaskit, you know, and I just want to acknowledge them that we're on their ancestral homelands right now. And I'm a Nipmuc. My ancestral homelands is just a little bit west of us, which is Central Mass, out of Grafton, Massachusetts, and Worcester area. So just want to acknowledge that. I want to just sing a song to kind of acknowledge, you know, all those who have we just spoke about. We whispered their names. Almost everybody must here have lost somebody close to them due to why we're here, correct? All right, so I want to sing a song, especially, you know, I think about my brother-in-law, you know, Ving, who took his life due to drugs and alcohol. So this is an honor song for him. And then you guys can yell the same way. So I just wanted to acknowledge my ancestors, you know, that we're in Boston right now, what they call Boston now, you know. It was in blue law that in 2006 we couldn't even walk inside the city limits without being accompanied by a musketeer who would be killed. And so I just want to acknowledge the struggles when it comes to indigenous peoples. You know, our population's only 2,000 in our community. We run an organization, it's called No Loose Braids, it's right over there. And it focuses on cultural revitalization and preservation. I'm a person in long-term recovery, 18 years, and so thank you for that. I just want to acknowledge that some of our peoples need a particular way that tie in our spiritual beliefs, our cultural practices, our ceremonial practices that tie us and will actually plug into helping us recover. And so the state here has a real problem with acknowledging like white bison and some of the road to recovery in ways that our peoples need here in the state. When our people's OD or, these people are going through what they're going through, we have to send them out of state. We got to send them to the Midwest or to the West or Colorado where white bison is kind of acknowledged. And so I'm here as an advocate for that, to come and wake up in our communities here. Indigenous folks need another outlet as well when it comes to the recovery world. And so I want to speak that into existence. I also ride with an MC called Red Rum MC. And so last week we did a run for MOAR and we raised a little over $1,000. And so we just want to welcome them guys up here for a moment. And if we can welcome Noel up here for a moment so that they can, give that donation because, stigmas, right? We're talking about stigmas. Doesn't the outside world give the recovery world a bad stigma? All right, well, it's the same with the MC world too, so let's talk about it for a second. There's a lot of bikers who are doing good things, and Red Rum MC is one of them, and so I just want to speak that into existence. And so they just want to give this donation. I'm going to let them speak.
How's it going, everybody? My name's Owen from the Red Room MC Nipmunk chapter. This past weekend, we did our first annual ride benefiting MOAR. We look to see some of these faces next year during our ride around the same time. So today, we'd like to present this donation to MOAR of $1,000.
Let's give it up one more time. Let's go. All right. There are some things that take your breath away. And when we start listening and we start hearing from those individuals that speak of those that came before us, it's a powerful thing. I want to take this opportunity, first and foremost, to thank those that have come out today. That means you, the person next to you, the person behind you. For those that are tabling today, sharing those resources and that information, let's raise up a shout out to them right now. We wouldn't be here if it weren't for the sponsors. We also want to thank one of our major sponsors who's here today. And let's put our hands together and let's welcome or let's thank BSAS, the Bureau of Substance Addiction Services. We want to thank those for coming out and thank those for supporting this move. So it's almost lunchtime, but before we have lunchtime, we want to invite our next speaker. You know, the recovery community deals with a lot of individuals, a lot of folks. If you look around, we have been there and we have done that. Our next speaker is a person in long-term recovery. His journey included nearly 5 years on medication for opioid use disorder, an experience that shaped his commitment to breaking stigma, sharing his story openly. He is the founder of Hardcore Connections, a nonprofit focused on building community, creating innovative supports, and ensuring no one has to walk this path alone. Let's put our hands together and let's welcome Mr. Jerry Randall.
What's up, people? Recovery is what? All right, so they already introduced myself, but show of hands real quick. Who here has ever encountered someone that has utilized the medication for opioid use disorder as part of their recovery? Who here has met someone that was successful. Right on. There it is. Now, my name is Jerry. I am a person in long-term recovery. Now, I want to see all of you put your hands up. Right? Thank you. Right? So someone with multiple unsuccessful attempts at recovery, right? Inpatient, trying to figure out what to do with my life, right? And I was a great starter, man. I would come out the gate strong. I'd get plugged in with almost every resource at this table. The problem was I would never call any of them, right? The cravings would kick back in before I was able to do some work on myself, right? So it was suggested through my peers. When I say peers, I mean cats that were on the unit with me, saying, Jerry, if you don't want to do this again, why don't you try some evidence-based practices? Now, we know stigma is very real when we're talking about methadone, Suboxone, not so much Vivitrol, right? But it's a little better than it was 8 years ago, okay? Right, I remember coming into the clinic, and I did not feel good about that, which is bull. Wow, I didn't swear there, Noel. That's growth. That's growth, baby. What? Who says people don't change, man? Right? Okay, so I knew that I was done with that song and dance, man, and I wanted all the things. And they told me, you chase your recovery half as much as you chase your using, you're going to be all right. Right? Being the addict that I am, addict behavior, so I'm going to do it 110%, baby. I never did anything in my life half-assed, right? So why am I going to try to recover half-assed? Got myself on the clinic, right? And plugged in with wraparound supports, right? Is any peer-to-peer people in the house? There it is, right? So it's swagtastic with you somewhere? I hope so, right? I want to give a shout out to Jackie if she's in the crowd. I would not have be where I am without my recovery coach in early recovery. So where are all my recovery coaches at? Yeah, baby. There it is. Do not underestimate the power of peer-to-peer support, man. I didn't feel comfortable talking to a clinician when I was coming out the gate. I didn't know her. She didn't know me. I didn't trust her, right? It took me a while to get there. It took me a while to get there, but you know who I did feel comfortable with? My recovery coach. Why? Because she was one of us. She was one of us, right? I had no problem giving her a call, or actually, it's an honest program. She would call me most of the time and say, what meeting are you going to today? I said, I'm not. She says, why not? Do you want to be on the clinic forever, is what she would say to me. Right? Do you want to be on the clinic forever? Okay, so my methadone journey was about 2.5 years, and I put that out there not trying to compare time with anyone, right? I didn't get on with a time frame. I got on with a to-do list. Right? I'm not going to come off of these medications until I'm able to check some of these boxes off my to-do list, right? And was able to do that through the help of some wraparound support, check some boxes off that list, baby, right? Transitioned over to buprenorphine. You guys know Suboxone, right? The sublingual film. Transitioned to that jazz. I'm like, now I can manage my own medication without selling it for a pack of cigarettes, right? Whatever. No. So rode that out for a few years before transitioning to the long-acting injectable. Right, which is the absolute game changer. So like Noel shared, man, I used MOUD for the first 5 years and changing my recovery, man. And the reason that I'm up here willing to share about this is to smash some of the stigmas associated with it. Right, thank you. I had cats coming out the cut saying, Jerry, where's your 24-hour chip? I said, in my drawer. 5 years old, homie. You know what I mean? Don't judge people. Don't ever discourage someone if they're doing something to improve their quality of life, right? If someone comes and said, Jerry, I used 6 times today. I said, how many did you use yesterday? He said, 7. I said, high five, baby. That is progress, right? You are in recovery when you say you are. Not when someone says you are not, right? Oh, sorry. My brain almost went to -10, but we're not going to do that today. It's a positive day, right? It's a positive day, man. Okay, and there's different fellowships now that are all-inclusive. Anyone ever heard of MARA? Right? Medication-Assisted Recovery Anonymous. We brought this to Plymouth in 2020-ish, right? Because I felt judged and shamed using traditional fellowships on medication. Right? I don't put that hold against the fellowship. It's the members in that group. If you're in there, I still love you. It's okay. Right? And I'm going to continue to pray for you. Right? But don't discourage someone from coming through those halls, baby. Right? So there's MAR out there. It's a judgment-free fellowship, right? To meet individuals where they're at, regardless of what we're doing for our recovery journey. There's cats that consume cannabis. There's cats that are on psych meds, antidepressants, anti-anxiety meds, and according to some, you're not sober. Right? We've all heard that. We've all heard that. I don't say that, and none of us should say that, right? Just like addiction is progressive, it's a progressive disease, recovery is also progressive. I don't know you, but I didn't wake up one day, it's like I'm going to do all the things today. I'm going to go to recovery day. You know what I mean? No. I've been coming here for the last, 6 years now. You know, yeah, man. super grateful to be in recovery. Super grateful to be the CEO and founder of Hardcore Connections. If you're not hip to what that is, you better get hip, baby. Right? We smash stigmas. Okay, we provide education. We help against relapse and drug addiction by providing community outreach and recovery education to smash stigmas associated with them. Okay. Meet people where they're at with compassion, without judgment. If you can't do that, don't say shit. Give them a hug and keep it pushing. Okay? There it is, baby. All right. Got my mad High Point peeps back here. All right. Some of you guys are like, where are you from? I know you from. Yeah, I was with High Point for some years. I know as part of the state opioid response hub and spoke grant to provide low barrier access to medications for opioid use disorder. Okay? If you're in recovery today, give yourselves a hand. If you're not in recovery and you support cats in recovery, give them a hand. If you support a state without stigma, let's throw it up, baby. Throw it up. The universal sign for I support a state without stigma. Let's go. Let's go. Well, I got a time frame, Noel. I just keep it pushing until someone grabs the mic. No, I'll keep it going, bro. You know what I mean? You know, I don't know if I got a time frame. My man's got a schedule. All right, thank you so much for this opportunity. I'm gonna throw some T-shirts out here. Catch it, baby.
Good job. Let's give it up one more time, Jerry Rando. Let's just be safe. Don't want nobody getting hurt. There you go. Look, my brother didn't even move. You caught that. All right. Wow, I get one. That's awesome. We have individuals that are looking for keys. If anyone has found a pair of keys, please make sure you turn them into MOAR staff. Or bring it to the registration booth, a pair of keys. And we also have someone that has misplaced a cane. They misplaced a cane. If anybody found a cane and it ain't yours, somebody needs their cane, please bring it to the registration table and or to a MOAR staff member. All right. We have another raffle. We have another raffle. We have a raffle from
Connect to Recovery at Riverside Community Care.
I'm going to invite this brother to say that one more time like he really means it. Where's the raffle from?
This is from Connect to Recovery at Riverside Community Care.
All right. Now, I'm not going to sing these last numbers.
Oh, you set a precedent.
All right. Okay, fine. All right, here we go. Ticket number. Here we go. 485-110. 485-110. If you have a lanyard, in your lanyard is a ticket. Your ticket should be with your lanyard. Last three numbers, 110. You can't win your own raffle prize or your own giveaway.
Yeah, we
Oh,
pull another.
we got to pull another one.
He don't need it. He's the program director.
All right, here we go. I'm going to blast this one's out. 484-077. 077. Read your tickets. It's on the back of your lanyard. 077. 077. come on down. You're the next contestant on Win the Giveaway. All right, all right. Come on up, come on up. 077. All right, come on up, come on up. All right, here you go.
Go, self-care basket.
Want to take a picture? All right, you gotta be quick with that, man. You gotta be quick with that. All right, folks, there's a conglomeration of things being lost. Someone has misplaced their cell phone. Their cell phone. I can personally attest to when you lose a cell phone, it's kind of heartbreaking because you got pictures, you got numbers in there. So if anybody sees a cell phone, please bring it to the registration table. It's light blue. Light blue. Our next speaker woo! This is awesome. Better this than rain. Goodbye. I'm not getting cooperation. Here we go. All right, thank you so much. Our next speaker represents Quincy and surrounding communities in the Massachusetts State Senate, a lifelong Quincy resident. He has championed public health, mental health, and recovery throughout his career in public service. He is also a friend to the recovery community and to MOAR. Let's put our hands together and let's welcome Senator John Keenan.
Thank you. It's great to be here. Good afternoon, everybody. What a spectacular day. I want to thank you all for coming out and for doing what you do every single day. Just to share a quick story, last Thursday I had my hip replaced. And I was in the hospital and a couple things struck me. One was as I was waiting to go into surgery, they came by and they offered me a warm blanket. And it felt really nice. But what I thought was, there's so many people in this state, in this country, all across the world, who don't have a warm blanket. And sometimes we take it for granted. So we should just be aware of how fortunate we are and be mindful of those that struggle every day to find a warm place, struggle every day to find health care. Keep them all in mind and keep committed to that cause. The second thing that occurred was after the surgery, I was in the recovery room and the doctor came into the room, the doctor's team came into the room and said, we phoned in a prescription for an opioid to your pharmacy, oxycodone. We phoned in oxycodone for you. And then something happened that didn't happen many years ago. They talked to me and gave me information about the risks of opioids. And then they said, and you do have the option to get a partial fill. You don't have to completely fill that prescription. Now that's a piece of legislation we were involved with a long time ago. And thankfully it passed. But I thought then at that moment, I'm glad we're having this conversation. I'm glad that's part of the protocol now. But I remembered how difficult it was to get something so simple, something so basic passed. And all the struggles we had to improve our prescription monitoring program, to do things like partial fill, to do non-opioid directives, to make sure that we had as much treatment in place, all those things, how difficult it was. But we're here today to celebrate, in some ways, how far we've come. To remember those that we've lost tragically, their families and their friends who have been impacted. We never forget them. But we're here to celebrate that we have made a lot of progress. But we cannot take that progress for granted. In this day and age, the science, the data that we as legislators rely on to help us form policy, the science and data that backs up what it is that you have experienced, what you have lived through, that powerful combination of personal experience and science and data is being challenged. So I ask you, every time or any time you see that happening, speak up and say, hey, listen, we need that science, we need that data, we need those personal stories, we need those stories, incredible stories of recovery, to make sure that we don't go backwards, but rather that we keep moving forward. As I look out here today at all of you, I know that you all come from different backgrounds, different places, you're here for different reasons. But what draws everybody here is the idea that we have to help each other, that we have a commitment to each other, whether you have lived experience, whether you've lost a loved one, a family member, whether you've lost a neighbor or friend, or you have somebody who's struggling with addiction, or you have somebody who's going through recovery. We're all here because we know that individually we can't recover. We only recover when we recover together. And I want to thank you for your commitment to that. As I've been involved in this work over the years, the words of Robert Frost, who was a poet, come to mind. In one of his poems, the last lines of the poem read like this: "The woods are lovely, dark, and deep, but we have promises to keep. And we have miles to go before we sleep. We have miles to go before we sleep. We have a lot of work left in front of us. We have an awful lot to do. So while we remember today and we honor today those that we've lost and we celebrate the progress we've made, let's commit to continue that progress. So keep sharing, keep caring, keep giving, keep living, and keep hoping." Thank you.
Let's give it up one more time for Senator John Keenan. All right, all right. At this time, if you have a pink lanyard, those of you that have a pink lanyard can make your way to the food trucks. That way you can start getting your lunch. For those of you that have a pink lanyard, you can start making your way to the food truck so that you can get your lunch. I heard that. All right, all right. First, let's continue on. I want to take this opportunity to thank all those recovery centers that work with reentry. But I also want to take this opportunity to lift you guys up and to also let you guys lift yourselves up. Western Mass Recovery Centers, where are you? All right. Central Mass Recovery Centers, where are you? Y'all got to make some more noise than that. All right. Southeast Recovery Centers, where are you? Central Mass, let's try that again. All right. Northeast Recovery Centers. North, East. All right. How about Boston? Can I hear Metro West make some noise? All right. All right. Yes. Once again, if you have a pink voucher on your lanyard, If you have a pink voucher on your lanyard, the color is pink. If anybody's colorblind, please help them out. Somebody next to them, make sure they know that, what colors they're looking at. Listen, reality is that, not everybody sees all colors. So let's make sure that if you have a pink, you can head towards the lunch trucks. Ladies and gentlemen, our next speaker as we move forward. This lovely young person was a former faculty member of Harvard Medical School and Recovery Research Institute. She's a community psychologist, and her research program examines the utility of recovery support services. Let's put our hands together and welcome Dr. Corey Vilsaint.
All right. Happy Recovery Month. Yes, thank you to MOAR for hosting this and bringing us together here today. Thank you for your kind introduction as well. We're really here today to celebrate the recoveries we have and to advocate for those who are still suffering. What up? And to advocate for those who are suffering. And, it's important that I'm a researcher. I work in numbers, right? I work in efficacy. I work in those things. And so, got it. Thank you. And so I want to let you know that we can tell them who are still seeking recovery, the odds are in your favor. 70% of people will get into recovery from a substance use disorder. Keep fighting the good fight. The odds are in your favor. That is a fact. We have seen some major shifts in this country when it comes to our approach to substance use disorders over the years. Addiction was once confined to the arm of the criminal legal system, viewed solely as a moral and social problem to be dealt with through incarceration and impunitive approaches. But then we had advances in the recognition of substance use disorder as a treatable medical condition. This led to life-saving pharmacotherapies and psychosocial interventions. But now we've got community-based services as this emerging third tier on the continuum of care, joining the ranks of mutual aid organizations, joining the ranks of treatment. We now have collegiate recovery programs. We've got recovery high schools. Peer specialists are providers now. We've got recovery organizations, Go More, recovery community centers that you can literally walk into in your community, and there's another emerging world of digital recovery supports. The goals of these services is all very different. We rely on our treatment providers to address symptomology, pathology, but we rely on our community to build recovery capital, to reduce stigma, to move barriers to care out of the way. And the truth is, though, the odds of recovery, they're not the same for everybody. The historical truth tells us that Black and Latinx individuals are about half as likely to remit from alcohol use disorder and substance use disorder in this country. Studies of the general population that have been carried out kind of like the census have let us know that this has been going on for over a decade. And this persists despite the fact that Black people are less likely to have a substance use disorder than their white counterparts. This is a true health disparity in our world of recovery. More recently, we've had some good news. We've had good news from the Center for Disease Control that tells us that overdose rates are down by over 20%. That's right. This means that more people are living, right? And we are back to levels that we haven't seen since before the pandemic. And this is something that we definitely need to celebrate. But the truth is as well that nationally, overdose rates have increased among Black and brown communities and decreased among our white counterparts. This is what makes up this decline in overdose rates. We must figure out why this is happening, and this is a true health disparity. How are these things created? How are health disparities even created? I say in simple terms, this is just disproportionate exposure to risk and protective factors. But what do I mean to that? Well, access to care. This can be protective. Medications used to treat opioid use disorder are indeed effective. In fact, we know that after 12 weeks of using medication, half of people with prescribed opioid dependence will be nearly abstinent from non-prescribed opioid use. However, we also know that according to studies of our Medicare claims, that our black patients are receiving medication at half the rate to white patients, even after seeing the doctor the exact same amount of times. And when they do receive medication, they're getting an insufficient duration, meaning under 6 months, with a less effective dosage compared to white patients. Unfortunately, naloxone prescriptions mimic the exact same trends. This means that overdose protection that we count on through naloxone is being given at half the rate to the populations who are actually increasing in their overdose rate. Why do things like this happen? The truth is that that when we go to implement new innovations and new approaches to improving health in a society that is unequal, new technologies typically end up favoring more privileged groups first, thereby widening inequalities unless underlying determinants are addressed. Therefore, interventions designed to reduce addiction and overdose may actually widen the health disparity gap at first. I'd also like to bring to your attention that even outside of that, we have a lot of recovery-related discrimination. This is a real barrier that contributes to health disparities and poor health of people who are seeking recovery. My study found that many people who have resolved a problem with alcohol and other drugs still face many barriers to rebuilding their lives because somebody knew about their resolved history with alcohol or other drugs. In fact, in this country, almost 15% of people in recovery report receiving inadequate medical treatment because they're aware of their history. 11% of people in this country in recovery said their insurance would not cover some of their medical costs. 16% said they could not get a job because somebody knew about their history. 12% were denied a loan. We did this with Pell Grants in the form of education, still ongoing. 9% were denied housing because they were aware of their history. 8% denied nutritional assistance. This was a federal ban on people who had criminal possession charges because of a drug. Lifetime ban on nutritional assistance. 8% denied the right to vote. The fact of the matter is people who were exposed to these types of recovery-related discrimination had higher psychological distress, lower quality of life, and lower recovery capital. So it does matter. And the effect was magnified for individuals who identified as black. They were twice as likely to say as their white counterparts to report that they were denied housing because of their history or not being able to get a job. Let's talk about solutions. We are going to need to restore access to housing, jobs, nutritional assistance. These are the rebuilding materials that people need to rebuild their lives, but they need access to these permits. These are the levers that we can pull to reshape the landscape of recovery. Additionally, there is a great deal of medical mistrust in Black and brown communities. We are going to need to work to let people know about the avenues to recovery, whether they include medication or whether they include non-medication routes. But our providers are going to need education as well. Providers will need education about the health disparities that are being perpetuated in the treatment of substance use disorders. I don't know a single healthcare provider that does not care about that, despite the fact that that information is now being censored away from them. This brings me to my next point. We're going to have to fight for our freedom of speech. The very information that I gave you, I am not allowed to share when my talks are funded by the federal government, such as the Center for Disease Control and things along that line. They literally edit race out of my slides. We are going to have to fight for our freedom of speech as a part of fighting for recovery for all. I want to thank you very much for this time up here. I hope that something here will help you connect with yourself and connect with the next person. My name's Dr. Vilsant. It is great to be with you today. Have a great day.
Let's give it up one more time for Dr. Corey Vilsant. Awesome, awesome. We have another raffle. Who's ready for another raffle? Who's ready for another raffle? I'm not looking, I'm not picking any, just grabbing one. Four, 8, 4, 2, 4, 3. 2, 4, 3 are the last 3 digits. Check your tickets. Check your tickets. Who's this raffle for? Who's this raffle from? Hold on. Y'all said that in unison. That was sweet. They could sing instead of me. Let's hear that one more time.
Casa Esperanza.
Oh, you gotta do it again.
Yeah. 1, 2, 3.
Casa Esperanza.
Check out your tickets. 848 243 243. Wow, I did mess that up. Yeah. I love that listen, iron sharpens iron, brother. All right. 4, 8, 4, 2, 4, 3. We have a nice basket over here for you. Going once. Going twice. Last 3 digits. I'm saying it again. 2, 4, 3. I'm reaching in for a new one. All right. Last 3 digits. Hannah, can you sing? Hannah, can you sing? Last 3 digits, 422. 422. 422. All right. Winner, winner. Chicken. Oh, here we go. Come on. All right. Hold on. This is a basket. You just won. Well, state your name.
Maureen McGlame.
All right. What's that?
Oh, it's 5.
Ah.
It's 5. Okay.
Yeah. Survey says. No, you're good. Let's check it. 485. Yep. 422. Awesome. Awesome. Look at that. Let's get a quick picture.
Here we are. All right. Thank you so much.
Awesome. Excellent. Can we, yeah, you're very welcome. Just want to make sure, help you down there. All right. Nothing better than winning a nice basket. All right. If your lunch ticket is orange, please make your way to the food trucks so that you can get your lunch. Hey, did y'all work that out silently? Y'all got orange shirts on with orange lunch tickets? All right, all right. Excellent. All right, as that lunch group moves forward, I want to take this opportunity to introduce our next speaker. our actual next speakers. This group is a volunteer-led nonprofit serving women in Hampshire County, Hampden, Franklin counties who have experienced incarceration, recovery, and/or mental health challenges. Through creative writing workshops and public readings, this group is called VFI, empowers women to share their stories, challenge stigma, and build leadership, community, and mutual support. Please put your hands together. Let's welcome Voices from Inside.
Good afternoon, everybody. My name is Judy Owens Holmes, and I am the Vice President, Board of Directors for Voices from Inside. It is an absolute pleasure to be here among kindred folks like mine, and this is our first time. So we have three writers with us today, and the first up will be Myra Nunnally. Please give her a hand.
Hi, everybody. How y'all doing today? My poem today is called Why Do Addiction Recovery? Let me see this right now. I am so addicted to you, but it's not like a drug or alcohol. Oh, okay. I am so addicted to you, but it's not like a drug or alcohol. It's like pure love. I was addicted to the way you felt and the way you laughed. Nothing was bad until we met and stopped talking. And now I'm so addicted that I can't breathe, even though I try to be fine without that wine. That's why I'm so defined. I am free. I wrote another poem called I Am Enough. I am enough to make it through the night. I am enough to make I thought day no matter my struggle. I have many struggles. I know I will be okay. I don't give in. I believe and have faith. I am enough. You are enough to make it through anything. You are enough to have through anything. You don't have to be perfect. It doesn't matter if you are smart. Just open your eyes and open your heart. Just remember, I am enough.
Thank you, Myra. That was wonderful. So next we have coming to the stage, Gypsy.
Hello, everybody. My name is Gypsy. I'm 1 year and 5 months in recovery. Yeah, I'm doing my thing. And I wrote a little something. Recovery is stronger. I stand before you today as someone who has lived two very different lives. There is a person I was in active addiction and a person I am now in recovery. When I was in addiction, I wasn't truly myself. Addiction controlled my thoughts, my choices, and my relationships. It stole my honesty and replaced it with lies. It stole my dreams and replaced them with shame. It took my peace of mind and left me in chaos. But most of all, my addiction took away the person I wanted to be, the mother, the friend, the family member, the human being who cared deeply but was trapped in a cycle I couldn't see beyond. But recovery gave me back what addiction tried to keep from me forever. In recovery, I've gained clarity, I regained self-respect, I rebuilt relationships I thought were gone for good. Recovery has returned to me something far greater than I ever expected. The freedom to live life on life's terms without needing to numb it away. Today I can show up for others and myself and make choices with a clear mind. I can find joy in small things, gratitude in the hard things, and strength in challenges. Addiction took so much from me, but recovery has given me even more. And I stand here as proof that while addiction may be powerful, recovery is stronger. Thank you.
Thank you, Gypsy. That was wonderful. And now it's my turn. I have a couple that I'm going to read to you today. As soon as I can get to them. Be patient with me. God's not done with me yet. So this first one I'm going to read is something different for me because it's kind of a collaboration with my little singing voice and my poetry as well. So bear with me, and I hope you like it. It's called My Soul is Resting. The pain and the grind that I had to endure has stabilized me. Of this I am sure. My soul is resting. It's such a blessing. Praise the Lord, hallelujah. I'm free. Knick-knack, paddywhack, give a dog a bone. We don't own the rights to any of these songs. So, sis, let the nursery rhymes go. Get a grip of the hem of his garment and never let go. Encourage others in the righteous way. There is none in what you used to do. Allow the past to fade away. Get out of your past. Don't you want to stand in truth? Take the commute. The pain and the grind that I had to endure of this part, I am sure. Because my soul is resting. It's such a blessing. Praise the Lord, hallelujah. I'm free. What does my soul have to do with it? It needs to be blessed, not stressed. It has been tested, tried, and now I stand in truth. Our souls hold our spirit. Stop tripping. Get with it. I thank God for my life today. There's no more chains holding me. My soul is resting as I recover. Thank you. So this next one I wrote back in 2013 when I, was walking out of addiction and knew that one of my gifts from my higher power was writing poetry. And it's called Just Because. Just because I have a good heart doesn't mean you can tear it apart. Just because I choose to be saved doesn't mean you can crucify me, then bury me in the grave. Just because I don't hang out anymore doesn't mean my life's a bore. It means that finally I take my life seriously, no longer walking around dizzily. Just because you saw me having a glass of wine doesn't mean I'm no longer on Jesus' time. He is always on my mind. Just because that dude likes me and has money doesn't mean he's worthy. Just because I pray daily doesn't mean I won't face chaos. It means I know who's the boss. Just because Sister Brown turned her nose up at me doesn't mean I have to act like a clown. I refuse to wear that frown, so I say, God bless you, Sister Brown. Just because she's on a bed of affliction doesn't mean we should rate her story as fiction. Pay attention to the to the dialogue and diction, Jesus is the narrator of all prediction. Just because he did me wrong doesn't mean he owns the rights to my song. It means I'm singing. So long. Just because he says he loves me doesn't mean he means it. So at the first sign of any wrongdoing, he gots to beat it. Just because he lives in me doesn't mean I can act like I've arrived. He will sit me down and raise up Sister Brown because she ain't acting jive. But because he lives and created the words for this rhyme, we can rest assured he steps in right on time. Thank you.
Awesome. Let's put our hands together one more time for Voices from Inside. Awesome, awesome, awesome. All right. Our next speakers. Our next speaker has been the director of Mass Bureau of Substance Addiction Services since April of 2019. Previously, she has worked for more than 20 years as a clinical director in social work in mass substance use disorder system. Her stated focus is on cutting-edge and inclusive care for individuals contending with substance use and co-occurring mental health disorders. Let's please put our hands together and welcome Director of Bureau of Substance Addiction Services, Deirdre Calvert.
Thank you. Thank you so much. Good afternoon, everybody. Yay. For those of you I haven't met yet, my name is Deirdre Calvert, and I am fortunate enough to be the director of the Bureau of Substance Addiction Services for the Massachusetts Department of Public Health. It is such an honor to stand here today as we celebrate Recovery Month, a time to lift up the power of recovery, the strength of community, and the hope that drives us forward. Today is literally one of my favorite days of the year, and I'm so glad to be here. This year is especially meaningful for me personally as I mark 14 years in recovery. Thank you. Recovery has given me my life back. It has given me my health, my purpose, and the opportunity to serve alongside so many of you who are equally committed to building a world where recovery is not the exception, but a reality. Here in Massachusetts, we have made strong investments in not only prevention, intervention, treatment, and recovery, but we also have a deep commitment to harm reduction because we know that every life is worth saving. Every person deserves dignity, and every step towards health matters. Harm reduction is not just a strategy, it is a declaration that we will meet people where they are, that we will never give up on anyone, and that hope is always possible. And in Massachusetts, we're seeing results. This year, Massachusetts experienced a 36.3% decrease in overdose deaths. That is 16% greater than the rest of the country. We are ahead of the curve as always. This is not just a number. This represents thousands of lives saved, families spared unimaginable loss, and communities that are strengthened. It is proof that what we are doing together is making a difference. I also want to acknowledge that every death due to overdose is unacceptable. Loss of life is something that is completely avoidable. Every person that we lose and every life lost was somebody's somebody. Their lives had meaning. Substance use is a treatable illness, and no one should die from this disease. But while we celebrate this progress, we know our work is far from done. Recovery Month is a call to action to continue breaking down stigma, to expand evidence-based care, and to listen to those with lived experience, and to build the systems that honor the humanity of every single person. So to everyone here, whether you're in recovery, you're supporting a loved one, working on the front lines, or shaping policy, thank you. Your commitment, your compassion, and your courage are the reasons we are saving lives. This month, let's celebrate how far we've come. Let us remember those we've lost, and let's recommit to the work ahead, because every recovery is real. Harm reduction saves lives, and together we're building a future. Thank you so much.
Good job. Let's give it up one more time, Deidre Calvert. Excellent, excellent. All right, folks. If you look at your lunch ticket, we have pink and orange that has already gone up. Folks, if you grab your lunch, please make your way back to your seats. We'd like to continue to have individuals moving through this schedule. And our next speaker is the Director of Recovery Services at the Massachusetts Department of Public Health, Bureau of Substance Addiction Services. She leads the Recovery Support Services Unit and supports the integration of recovery services throughout the continuum of care and beyond. She has led expansion of recovery support centers. Let's put our hands together and let's welcome Director of Recovery Services of BSAS, Danielle O'Brien.
Thanks for the love, everyone. Danielle O'Brien, Director of Recovery Services, as he said, but more importantly, a person in long-term recovery. I know everyone's running around and socializing and eating lunch and just seeing people they haven't seen in a while, so I appreciate that some of you are actually paying attention, because I too need peer support. Thank you to our leader, Dee, who went ahead of me, who fights the good fight on our behalf every single day. I'd like to acknowledge some folks from the Bureau of Substance Addiction Services, Nicole Schmidt, who couldn't be here today, who supervises me, which is not always an easy task. Deputy Director Sarah Ruiz, who oversees the office that I am in. All my colleagues who came out here today to volunteer. My colleague Jen Miller, who is leading that charge of corralling volunteers, which she's amazing at. Thank you. And all of the BSAS staff who came out to celebrate recovery. It means more to everyone than you could know. I'd like to thank Noelle and the MOAR staff who worked so hard to make today possible, but also all year long. The way that they are out about in the state to educate, advocate, coordinate community, and raise the voice of lived experience all year long. Thank you, MOAR. I'd like to recognize Doris Cox and the team from Bay State Community Services for supporting MOAR, this event, and their consistent commitment to supporting recovery services, including the Recovery Education Collaborative. Shout out to Chris Savage and the REC team, Paul Smith and the team from Mass Young People in Recovery. My peer, are you here? And a special thank you to Lisa Scanlon for all her behind-the-scenes work this year to support the Peer Recovery Support Center events. This year's theme is Recovery is Real. Where's Sunshine Scotty? There he is. He's been letting us know that for a long time. The rest of the national movement is just getting hip, but Scotty's been letting us know that recovery is real for a long time. And this year they raise up REAL, standing for Restoring Every Aspect of Life. I can't say that I couldn't agree more with in the way that it's been in my lived experience, in the way that we approach our recovery services. Indeed, recovery is real. Today is a testament to that. We stand today together in hope, honoring each other's lived experience, resilience, and raising up the power of connection and peer support in supporting each other's journey. We celebrate together and recognize the power that our stories, visibility, and unity coming together as a statewide recovery movement have in the fight to overcome adversity, stigma, and discrimination experienced to make it easier for the next person, our next peer, our next friend to find their way. In times where everything seems very divided, it's been such a gift and a comfort to be part of something that brings everyone together. A little over 14 years ago, I'm dealing with the wind. Hang on. I need a little grace. A little over 14 years ago, it was hard for me to believe there was a way out. Like many of us, I suffered alone, I struggled, and I was losing the battle. I began asking for help, but was not supported at first. The layers of stigma were taking their toll. Unaware of the treatment and recovery supports and how to access them around me, I started to think that perhaps this was not possible for me. Fortunately, later in my progression, I encountered someone in long-term recovery who planted a seed that I could find recovery and suggested long-term treatment. Some need a little more help than others. Eventually, I did have the opportunity and decided to give myself one honest shot. It was the best decision I've ever made in my life. I ended up getting connected to a peer recovery support center after treatment. Shout out to the Divine Recovery Center. From there, getting involved with MOAR, the statewide movement, into this field, and so on and so forth to where I am today. I came in seeking relief from pain, and the recovery journey I am on has far exceeded that. Not only restoring every aspect of life, but offering a whole new life as a person in recovery. Now to the good people that are here. Yeah. This is how we approach our recovery service in efforts to create systems that are more recovery-oriented. This is what I have witnessed in working with the amazing recovery communities across the state, so many of which are here today. This is not just symptom relief, as Dr. Vilsant mentioned. Recovery is a process of change that involves the whole person and restoring every aspect of their life based on their choices, challenges, their lived experience, and individual hopes and dreams. We seek to create a commonwealth where all residents can easily find recovery and the support they need to live their best life in their community. We have incredible recovery programs and a strong peer workforce. And I know that Noel already did it, but he did it regionally. So I'm going to try to see if in the midst of all this socialization, I can get some people to cheer with me. But if you are connected or have ever been connected to a peer recovery support center, can you cheer? I knew you were here. Is there anyone here serving in the role or training to become a recovery coach? If you are new in recovery and here today or just stumbled upon this event, please seek these people out. You do not have to do this alone. We walk beside each other on this journey. I'd like to recognize the loved ones impacted who support recovery who are here today, who bring their own experience and are an instrumental part of our broader recovery family in Massachusetts. To all of you and the allies that champion in recovery, thank you for celebrating, supporting, and advocating for us. We cannot do this alone. All right. Now this is a big ask. Hi, Lorraine. I'd like to see if we can get loud enough to let everyone in the common today know that recovery is real. All in together on the count of 3, can we get everybody to scream, recovery is real? 1, 2, 3. Now that is powerful, and as you can hear, together we can. Thank you.
Thank you. Let's give it up one more time. Danielle O'Brien. All right. As we continue to move forward, our next speaker, she started working for Spectrum Health in the fall of 2017 as a case manager, leading to her recovery support in 2022. Everyday Miracles Peer Recovery Support Center. She is a trained recovery coach and Massachusetts certified peer specialist. She currently serves, empowers, and inspires people in recovery. Let's put our hands together and welcome Assistant Program Director from Everyday Miracles, Teresa Muccio. Also, Lil G. Let's give it up for Lil G. Y'all can make a little bit more noise for Lil G. Come on. All right. All right.
Thank you. Thank you, everybody, for having me here today and giving me the opportunity to share my strength, love, and hope. I'm a woman, 18 years of recovery. I'm also a mother. I'm a poet. I'm an author of narrative essays for Mass Humanities, which is assisting to change the narrative in Massachusetts from stigma of addiction to actually recovery is possible. Thank you as well to Project Redemption, who just recently had the privilege to go to the State House and also help in the fight of stigma, putting our faces to recovery. Thank you. So today, with me, as you heard already, I have little G with me, and she is standing here in the gap for her mother, who cannot be here today amongst you, but she's gonna stand in the gap, as many of us today stand in the gap for those who need to come and that are not here yet. That's why we stand as a testimony that recovery is possible. So with me, the chant that we had earlier today going around the common, I'm going to hand over the mic to little G because she's going to go ahead and affirm that one last time. And man, if you allow the children to lead, we actually may have a bright future. Go right to the light. What are you going to say? Hey, hey.
Hey, ho, ho. Recovery is good to go. Hey, hey. Ho, ho. Recovery is good to go. Hey, hey. Ho, ho.
Recovery is the way to go.
Ho, ho. Recovery is good to go.
Yes. Thank you. Thank you. Go ahead and grab yourself a seat, honey. So I'm going to have the privilege in the next minute or two to recite two of my original poems for you. This poem that I'm about to recite was first actually performed at Mechanics Hall in 2024 for the Black Excellence annual Mechanics Hall meeting. And the portraits of Frederick Douglass and Sojourner Truth were going up. And as part of Clementi Course of Humanities, I was asked to come up with an original piece. And I said to myself, in such a historical place like Mechanics Hall, where Mark Twain and those of other likes have spoken, I received this opportunity. If it's one shot like Eminem, let's go. I am healing. Hold on, I gotta let go of this mic. Can you hear me? I said, I am healing from my ancestors' pain, passed down like physical traits. Though you can't see the broken chains, in their place, scars remain. Evidence, the present in the aftermath that bridges my future to its past, the silver lining in today. I am no longer lost, searching for pieces of myself in strangers. Once, I realized that everything was broken. As in Eden, my foundation corrupted. Time to write a new Genesis. Never more a fatherless daughter laying in the ruins. I am a child of God. So, pen in my hand and all of my pieces held together in his, forevermore free. History rewritten. From the ashes I rose to sing my mother's song. Have the world see me through my grandma's eyes and hear my story. I am healing. I am you. And fortunately, I got another privilege because we were ahead of time to recite another poem that I have, an original piece. So I'm going to take my opportunity in the Boston Common. Thank you, MOAR, for knowing how to give me a stage. This poem is titled, My Sunday's Best. $1 by the pound sounded like the sale of my pride. Oh, silly child. Rummaging through piles of others' unwanted stuff, looking to find what I needed. Felt unfair at the time, wishing I knew then what I do now. Silly child. To be continued. As a woman, I thrifted $1 million wardrobe. I'll say the most with a smile, but the roots to the skills were etched in pain, but not like the handheld game of black sand and knobs that could erase the lines of wrong turns made. Permanent memories can't be resketched, but they can be reframed, repositioned, and regained. As a woman, I thrifted $1 million wardrobe. Thank you, everybody, for your time. Thank you for the opportunity to share my hope, love, and strength. Writing through poetry is the way that I found part of my recovery and part of my healing. So I encourage anybody who is looking for a positive outlet to do so. Pick up a pen, pick up a notebook. Your story is not done being written.
Let's give it up one more time for Teresa Buccio. It's time for another giveaway. My helpers disappeared on me. So I'm going to come over here and do this myself.
I'm so sorry.
All right. If you're paying attention, here we go. We got another raffle on the road. I'm going to read this precisely. 4, 8, 4, 5, 0, 8. Please check your tickets. 5, 0, 8. Come on up here. What are we raffling off? Let's get the whole team up here. Come on. Come on. You don't even act like you're scared of the mic. State your name.
Mark Mohammed.
State your name.
Wendia Rodriguez.
State your name.
Chris Savage.
And who are you guys from?
We are up here with the Recovery Education Collaborative, better known as the REC.
Hold on right there. I'm gonna pull this one out. I need the folks in the back to hear you, Chris. I need you to use your outside voice. We have a giveaway, and what is this?
Wait, what are you asking?
No. Who are you and what do you? Yes.
We are here with the Recovery Education Collaborative, otherwise known as the REC.
All right. And we have a winner. Come on up. What's the last 3 digits? 508. Winner, chicken dinner. Here we go. Let's get a picture, Nate. She gets the whole bag. You trying to take some of that home? What's your name?
Lauren.
All right. Congratulations, Lauren. Let's get a quick picture. All right, but before these folks go, thank you. We have 2 of recovery coaches' best up here, and I want to give them the opportunity just to talk about where they're at, where they're going, and what's happening with recovery coaching. Where are you at? What are you doing? And what's happening with recovery coaching? And just maybe a wise word for those that inspire to be recovery coaches and those that are recovery coaches. Here you go.
Again, I state, my name is Mark Muhammad. I work with the Recovery Education Collaborative. Thank you, Noel. I also work with Choice Recovery Coaching, which is located in Springfield, Massachusetts. I'm also a supervisor for recovery coaching. If there's anything that I will say to those who want to be recovery coaches, come in with your experience, remember your past, and always remain humble. And if you keep those 3 principles with yourself, you'll be fine. You'll be fine. Thank you.
So, hi, Wendia Rodriguez, person in long-term recovery. In 13 days, I will have 14 years in recovery. And in 2015, I took my recovery coach training, and that started my whole trajectory of my career. I started at a recovery center, and that allowed me to take my recovery coach training. So if you're at a recovery center, if you are somebody who's early in recovery and you're interested in helping other people, recovery coaching is definitely where it's at. You can take the classes through the Recovery Education Collaborative. We also had a BIPOC workforce development, so if you're a person of color and you're interested in taking these classes and you want to be around your own people, we also have that as well. So please look us up. We have a little table over there. We have a few pamphlets left, bags, and if you want any information, please see me or Mark or Chris after this. Thanks.
All right, let's give it up one more time. The REC, the Recovery Education Collaborative. All right. Folks, I have a housekeeping thing that I have to announce. If you're getting your lunch voucher is only good for 1 meal at 1 truck. 1 meal at 1 truck. I know some of us want to try a little bit of this, a little bit of that, but 1 ticket per truck, or 1 ticket for 1 meal. All right? I hope that's all right. It's called grace, man. It's called grace. All right. All right, so if you have yellow, did yellow already go get their lunch? Yep, yellow already went. All right. Unfortunately, the next color is green. If you have a green lunch ticket, yellow didn't go. I just asked that. Yellow. Oh, I did announce yellow. Oh, some folks maybe weren't listening. Just saying. All right, if you're yellow and you didn't go, get up and go, pick your truck and have an enjoyable lunch. Stuffed sopapillas across the border, hometown burgers and bimbocks. Don't ask me to say that again. You ain't singing that one either. All right, ladies and gentlemen, our next speaker is a program supervisor of Massachusetts Massachusetts Young People in Recovery and has been sustained in recovery since July of 2023. She got involved at My Peer first as a peer, and she joined the team as a staff member in May of 2024. Amazing people doing amazing things. Let's put our hands together and let's welcome Grace Sullivan.
Thank you. Thank you so much. Before I begin, I'd like to say a huge thank you to the Department of Public Health, the Bureau of Substance Abuse Services, and Bay State Community Services, and of course, Massachusetts Organization for Addiction Recovery. It is such a privilege and an honor to be here as a part of MOAR's 35th Annual Recovery Day. My name is Grace Sullivan, and I stand before you today as a young person in recovery and as the program supervisor of Massachusetts Young People in Recovery, or My Peer. My Peer is a program of Bay State Community Services that provides peer support services to young adults ages 18 to 27 all across the state of Massachusetts. We meet our peers where they're at on their recovery journeys, walking alongside them and giving them the space and resources to build the recovery capital that they deserve. My Peer is exactly what I needed when I was turning the page from adolescence into adulthood. Sometimes I think I would have gotten into recovery earlier if I had known about it, but that's okay because I'm here now. Like all of you are here now. But that's okay because My Peer is still exactly what I need for my recovery into my 20s. My involvement in My Peer is a lot more than employment. I feel fulfilled daily sharing about my lived experience as a person in recovery, listening to our peers about their lived experience, and planning and attending fun, substance-free events that young people actually want to go to. And obviously partaking in the beautiful process of peer support. So what is peer support? Anyone know? The theme for Overdose Awareness Day this year is one big family driven by hope. And to me, that is synonymous with the beautiful process of peer support. People helping people with what they have learned throughout the course of their life. Just as a parent teaches their child how to ride a bike, or a sister teaches their sibling how they walk home from school. Today, looking out into this crowd, I see one big family driven by hope. I see one big family driven by hope. Hope that loved ones still struggling with the disease of addiction will find their way. Hope that lawmakers will pass life-saving bills to help people still struggling with addiction. Hope that resources that are shared today will be made available to those who need them. Hope that together we can. I believe peer support is most effective when it comes from a true peer. I don't dismiss that older folks have a lot to teach us. You guys are very wise. But support from another young adult to another young adult has its own power and magic. I was 17 years old when I first realized I should probably get back into recovery. I didn't know what that would mean for myself. At that very young age, my life had been falling apart due to my substance use. All I had known about recovery is what I had seen on TV or from the meetings that my very well-meaning father, who is in recovery himself, had dragged me to unwillingly. But it was there in those rooms that I felt different. I felt young, I felt new, and I could not bring myself to feel a part of. It wasn't until I entered recovery spaces this time around when I turned 20 years old that I realized that there are people like me in recovery, and there are people like you in recovery. I began to seek out support groups, meetings, activities, friendships that involved young people like me. People like me were in recovery. I realized that even though recovery looks different for everybody, recovery is for everybody. Can you guys say that? Recovery is for everybody. My Peer is a movement that embodies that statement. Recovery is for people of all races, genders, sexual orientations, countries of origin, and ages. It is never too early or never too late to enter recovery. Recovery is for everybody. Thank you.
Let's give it up one more time for Mass Young People in Recovery. I get excited about that because when you think about Mass Young People in Recovery, that's the next generation. Well, I'm glad we got one person clapping for the next generation. Awesome. Awesome. Excellent. Our next speaker is a spoken word poet with 5 years of experience of turning raw emotion into rhythm. Her work is deep-rooted in faith, mental health, and radical authenticity, creating space for healing, truth, and divine connection. More than a poet, she considers herself a vessel, a simple creative in the hands of the Creator, using her voice to stir hearts and to spark transformation. Let's put our hands together and let's welcome Haley Mae Baker.
All right. How are we feeling? Boston, what's going on? Yes, that's the energy I'm talking about. So my name is Haley Mae. Just like I was introduced, I am a spoken word artist from Providence, Rhode Island. Anyone from Providence in the house? Okay, there's a few of us. Now, I will be doing a piece that is really going to challenge you to think. So I want anybody who has not really been paying attention, now's your sign, now's your time to lock in. We're going to go deep for a second. We're going to go real deep for a second, and we all know why we're here. We appreciate the journey that has brought us here, and we're going to go a little deeper as to why we are here. So let's all gather together, and I want you to sit with this question for a second. Who are you known to be? Who are you known to be? Who am I known to be? Am I made up of more than flesh and bones? When you look into my eyes, do you see more than a face? When you hear the words that are formed from my vocal cords, do you feel my passion, or does your attention span far away? Will I ever be truly known? This is the topic for today, so ask yourself this question: will I ever be truly known? Past participle of know, to be recognized, familiar, or within the scope of knowledge. But if the unknown is left in the dark, then I would describe the known as to be brought to the light. How can one understand something that is hidden unless it is explored? Likewise, the story of my life is hidden behind this flesh and bone, and the only way to explore is for me to be your tour guide. So hi. If you have any questions for the duration of this tour ride, please wave your hand high to make yourself known, and so we begin. The tour behind this skin you see standing before you today. It is my hope that by the end you will not see the woman standing before you, rather a mirror, where you see yourself through a soul of vulnerability. We will be addressing all three components of what makes up human beings, them being mind, body, and spirit. But I suppose we can begin with the body, since that is the first to be seen when we meet. So, body. A, the physical structure of a person, including the bones, flesh, and organs. B, giving material form to something abstract. Don't you see? There is more to me than what meets your eyes, our bodies. individually gifted to us from birth. This body, this is mine. I'm too hard on it at times, mostly every day. I call it names and bully my skin as if I am not already affected by it. I'm learning how to give myself grace and not to beat up myself if I eat too much or too little. Because whatever I eat, I know it'll be what my body needs. This olive skin. My color swatches from island sand. This hair and iris matches the soul of the earth. The detailed ridges of my eyes look like sand dunes in a desert. And every day I'm amazed how my curls spring forth like flowers by the sea. But what are you really? Well, I'm mixed. However, in case you still don't understand, allow me to break it down for your mind. Mixed is another word for stuck in the middle. And I really wish more people would talk about how difficult it is to be in between, because really, there is no home to call your own. Perhaps that is a conversation we are not entirely ready to have, although it needs to be had. Our healing, our bodies, my body has internally suffered since about 10 years old. Migraines, fatigue, IBS, and a possibility of diagnosed lupus weighed heavy on my developing body. From child to teen, trying to live, create, and play the sports and instruments of my dreams, who would think the illness of the body could attach itself to the mind, yet still I tried. What I've learned about our bodies is that they go through everything we do and deserve so much more love, health, and care than what we'd ever care to admit to. So even if your body is not a dream goal, even if you can't lose or gain the weight you would like, still find the time to show the entirety of your body grace. And in time, you will learn to accept your frame through every shade, shape, and season. After all, our bodies were not made for our critique. Our bodies are made to be temples, vessels of the Almighty God, an extension of heaven. That is who we are. And now, we move beyond the surface of our frame into the place we so try to numb and hide to stay away from our mind. Mind, the element of a person that enables them to be aware of the world and their experiences, to think and to feel, the faculty of consciousness and thought. A daunting place to be, my mind, a battlefield, so proceed with caution as I welcome you into the darkest place in my being. For context, we will start at the beginning. I was born a wild child, in the best way possible, with creativity flowing through my brain. I was always exploring. Curious. Some call it nosy, but I call it curious. That was me. I would examine the little things and overthink with such awe and ease. I always said I don't think this world is fit for a young mind like mine, and I was right. At 11 years old, I experienced cancer consumed a loved one's heartbeat and my own blood brother leave. When you're barely a teen, you don't know how to cope. Stuck with grief and neglect, two things my young mind cannot quite comprehend. The sun stopped shining when the rain became my only friend. I didn't mean for it to happen so young. It was so dark, I didn't realize I was so lost. Family life got complicated real quick. This was around the time I got real sick in my mind. I tried to get out of bed, to put on some clothes, to go to my school, to go eat some food, to shower, to move. I could not move. I became overwhelmed and too tired. Too tired to crack a smile, too tired to make a joke, too tired to stay afloat. I was drowning too fast and nobody knew. Nobody knew, and it drove me crazy, so much so that I thought to take the pain from my mind and put it outside in a place where I could say, see, it's not all in my mind. And this is when the question would arise, will I ever be truly known? In fear, I doubted that the day would ever come. I did not know that depression would arise and anxiety would be my demise, for at this time I was still in denial. Until the doctors ran some tests and realized what was wrong with my body was really wrong with my mind. Sleepiness all day, chronic stomach pain, and the appetite delay was all in the name of mental illness. So I finally found the courage to come clean. I confessed to my parents of the harm I was actively committing towards myself and the thoughts that had consumed all of my mind, so much so that I began to value death more than life. How could that feel? Hearing your last child say, when the morning comes, I pray, I do not reawake, that is pain. Pain to every single ear that hears those words come out of my mouth, but I can guarantee I am not the only one who has taken those words into account, because statistics say that half the minds under the sound of my voice suffer from the same mental illness I also admit to. So please, men, women, children, or teens. If any one of these comes and admits these pains to you, take heed and believe them. Mental illness is not a sympathy card. It is the second highest leading cause to death. And that is not how mankind was designed to take its last breath. So I plead, learn from me. If those thoughts became actions, I would not be alive to reveal how I survived and healed. How then have I survived for the past decade with an illness of mind? Welcome to the final part of my story called hope. This is my spirit, my soul. Soul, the spiritual or intangible part of a human being regarded as immortal, are souls, the home of our being. Where mind and body have failed me, spirit never has. Holy Spirit, that is. When 2/3 of your body is already compromised, the rest just wants to fall in line, and at times I've tried to. I know I am not the only one who has been in this state of feeling weak in their body, mind, and spirit all at the same time. So then how have we survived? Has it ever occurred to you that there is more that is desired than all the pain we have acquired? There is a reason we have all cried through our tears and wrestled through our fears. We are made for more. That is something deep in our spirit we know, but what more were we made for? Every spirit has a hole, a void we try to fill. Whether we try to fill it through intimacy, healing, religion, substances, or fame, we must truly reframe what makes us whole. The void in my spirit went so deep that I became so shallow. My behavior became a stranger to me. My desire to be whole was costing my spirit, my soul. I was looking in places I did not belong, left grieving over the trauma that had been caused, but I never found deep relief until I allowed myself to be crowned by the Prince of Peace. Accepting him into my soul is when I realized only he alone could fill that void. And now my spirit rests in the hands of the one who saved my soul. Here ends the tour guide of knowing my being through mind, body, and spirit. So what does it mean for you to be truly known? Is it as surface as someone knowing your name? Does it require vulnerability to share your story just as I did today? Is it as simple as having a solid friend to walk with you through the sun and the rain? Or is it to be understood perfectly from the deepest depths of your being? I believe the only one who could know me truly is the one who formed me in my mother's womb, the potter who formed me as his clay, creating all the intricacies of me and my being, for he sees me in this season and in the next. My life will never be too complex to the one who gives me breath, but I pray that you would walk away today being honest with yourself and others as well. Because to be known requires a two-way street. So how could I understand your story that is hidden unless you are willing to walk into the light? Who are you known to be? Are you made up of more than flesh and bones? When I look into your eyes, do I see more than a face? When I hear the words that are formed from your vocal cords, do I feel your passion, or does my attention span far away? Will you ever be truly known? Thank you.
I don't know about you, but I need to kind of exhale on that. That was a lot to take in. That was powerful. Let's put our hands together one more time. Haley May Baker. All right, all right. What I'm going to do right now is I'm looking for a young man that's going to come up here and share some of his words as well. This young man he has some music that he shares, but I feel like he's going to share some spoken words of strength and hope. This young man unleashes the truth behind disease and addiction, and the pain of his story becomes his strength. And he attempts to reach the masses with his life through music. And this young man's vision is to create a new style of music in a genre of its own, exposing the glorification of drugs in the music industry. But he's going to bring some poetic, some spoken word today. So let's put our hands together and let's welcome Mike DiNatale. DiNatale.
My name's Mike. I'm an addict, a grateful addict from Boston, Massachusetts. It's so good to be here. I want to thank MOAR. Can we give a hand up for MOAR, for Hannah, Noel, everybody involved with this event today? What a time to be alive. What a time to be clean from drugs and alcohol. What a time to be in, my mother just told me, the oldest park in the country, Boston Commons. And I have a lot of experience out here, as I'm sure a lot of you do, on some not so happy days, not so happy times out here in the Commons. Homeless, strung out. Nobody trusts me. I don't even trust myself. Disconnected from God. I've been out there in all different shapes and form, and today I can honestly say, this is the best I've ever been doing. This is the best I've ever felt in Boston Commons. I'm so grateful to be in this program today. I can see half of you are engaged and half of you just want to grab a sandwich, which is fine. Totally fine today. I'm going to drop some experience with some rhymes. And instead of telling you how bad it was out there and all the stuff I've been through, instead I'm going to share a verse. Maybe wake you up a little bit. Nobody thought I would make it. I know what it's like to be hated. Everybody used to run the other way. I wonder what they could be saying. Up in my head with the devil debating. Yeah. Up in my head with the devil debating whether or not to go after the dragon. No hesitation. Often I'm running. I wish I could stop, but I'm already cranking. Somebody help me. Somebody please. I'm out of control. Got nowhere to go. I know I need help. I need to get clean. I got this ball and chain weighing me down. I'm sick. I got a disease. I was the one they were talking about when they said to be careful and hide your keys. Growing up, I was like Dennis the Menace. They never knew what I was gonna go do. I had no meds. I was so mental in school. No wonder they gave me the boot. That's when it went from bad to worse. I went to rehab and learned to shoot. Couple of years later, I was in Broward, kicking on doors like, give me the loot. I was in Palm Beach and Dade. I went to Charlotte. I was in Maine. I was in Weymouth, Quincy, and Brockton looking for ways to cope with the pain, but nothing could ever take away the shame. Cover the nightmare on my veins. Always in 4-point restraints because they know I'm a little insane. I was at rock bottom with a shovel digging. I would OD and try to keep it hidden. All the Narcan had me sweaty dripping. I was out there with the devil ripping. But look at me now, I'm forgiven. I'm working for God, it's no wonder I'm winning. I'm back at my house with the family, chicken and steak, barbecue grilling. That's enough of that. Yes, sir. Again, how good is it to be clean today, out here, not fiending for another hit? Woo! That's what I'm talking about. At the end of the day, all I did was come out here with the willingness to be honest, with the willingness to be vulnerable, and tell you, listen, I was a degenerate addict. I had no hope. My family, they wrote me off. Nobody thought I was gonna make it. But look at us now. Look at us now, man. All of you could call your family, ask them for something, tell them something, they can believe it. That's the power of the program. I came out here to let you know that God is such a good God, a powerful God. And the only reason I'm up here today, clean, is because of him. I never was willing to do the work. I'd always go in and out of detox, in and out of meetings, and hope I would just get better. I hope being there would just get me better. Please, I never wanted to do the work. I never wanted to get on my knees and pray to God and ask for direction and tell him I was willing to be, I'd do anything. Just help me. I can't stand this life. Suicidal. Lost my brother. My godfather killed himself. Life happens. No matter what, we can't give up. And I wrote this letter, I want to share it with you. It's to God. I wrote this letter to Christ. Dear Lord, I know you're there and I know you can hear me. But I just had to write this out so I could say it clearly. You came and saved me. I was broken. Life was getting scary. You brought me home and now it's Sunday dinners with the family. I used to stay awake at night, ashamed that I was fiending. I needed you, but I wouldn't pray because my arms were bleeding. All those nights of screaming, crying, wrestling with demons. I think about the face my father would make when I was leaving. So many times I left that man just hanging high and dry. Told him this time would be different. Every time it was a lie. I wanted to make him I wanted to make him proud, but man, I was going to war inside. I miss the days we just play catch to make the time go by. So many friends are gone that never said bye before they were leaving. I told them all about you, though, in case they got defeated. So many people are out there right now looking for meaning. I hope my lyrics find a couple of kids out there that need them. I miss my boys. I make this music for their mothers grieving. I hope my lyrics help a couple people keep on dreaming. I'm just grateful I have someone like you to believe in. But all I'm really trying to say is thank you for this freedom. Yeah. Every single day I take a cold shower. Every single day after that cold shower, I get on my knees and I pray to God. Every single day. It's been over 1,300 days now. I think it's like 1,340 days in a row. And I remember coming up a couple years ago to this event and telling people about it, like, hey, this is what I'm doing. And at the time, I kind of wanted a pat on the back, like, this is crazy, look at me, be proud of me. Now, it's not about that, it's about the discipline of it. I know that if I'm taking a cold shower, that I'm getting on my knees and I'm praying and I have another chance. And the only reason I'm here, like I said, is because I continue to pray to God. I continue every single day to pray to the Lord. Help me, Lord. Let your love shine through me like a fog light, so those who are lost, sick, or dying may find your love through me. Mike D. So listen, I wrote this for my brother in heaven, and anybody who's lost a brother, yo, D, this is for Alan too, bro. I need to get this off my chest, bro. I miss you to death. Since you've been gone, it's like I'm numb, and I can't shake the regret. I would have saved you if I could have, but my life was a mess. I couldn't even sober up to come and pay my respects. I miss you, I wasn't ready to carry a weight this heavy. Sick of fighting back tears, man, lately there's been so many. You were always my rock, bro, now I feel so unsteady. Hope you're laughing with Joey and Grandpa having spaghetti, ugh. And I refuse to sit in silence. Our friends are still out there dying. I miss you, I need some guidance, bruh. Flying out the ashes like a phoenix, how I'm rising up. All my friends are dead, I just can't take it, man, I've had enough. All of these years, you think I would know how to make it all better, but damn it, I don't. You were the one I would go to, and no matter what, you were there when I needed you, bro. You told me the way and showed me the ropes. I wasn't ready to be seeing you go. Man, I wasn't ready to be seeing you go. I'm on a mission with this pen. It has red ink and it's dripping. When you walked up in the room, everyone shut up and listened. I can't believe you're really gone or that I'm in this position. I'm like a father to your daughter saving up for tuition. When I said I had your back, this isn't what I envisioned, but just know I wasn't kidding. I've had her since the beginning. It's up to me to change their minds about this life that I'm living. You told me what you think of Jesus, so I know you're forgiven. Yeah, I know someday we'll meet again, brother. In a place we won't have to watch each other suffer. But till then, watch what I do with this new life I discovered. Now I get to see my mother proud of the man I'm becoming. Get to give my father a break from those years I was running. Now he's whistling and driving on the steering wheel drumming. Now we joke about the past like it really was nothing. Hope you're chilling up in heaven and my music is bumping. I got a song if you want or no. Yeah. You want to play? So the DJ, all right, you know what? I won't go there. We could press play on something and I could show you a song. It's called Rescued. This song is really just to hype people up that you can be clean, man.
Sweetest angel
Never
in the
give
world.
up. You never know when you'll be rescued.
Yeah. Thank you for me and Miss Peaches.
Never give up. You never know when you'll be rescued. Keep your faith and know that if you do, that God will bless you. If you're breathing, then I promise you there's still potential. Like Miss Peaches from the kennel to the presidential. New life with bright lights. I'm locked in like a new season. All I know is I was rescued. I got new purpose, a new meaning. New deck with a new hand. Royal flush. Can't beat it. I was chained up and mistreated. Got a hot head. I could take a beating. I was all over the map and back in the trap. Dreaming of beautiful beaches. Now I got another chance. I'm thinking my dad. Feeling like Miss Peaches. I was all over the map. I was at rock bottom. Everything was in pieces. Now I got peace. I'm off of the street. Telling my story. I'm hoping it reaches all of these people who need it. All of these people out there that are fiending. Every last one of these people who live on the street that are looking for meaning. Let me just say, I was there too. I was down in the valley like do. Now I can feel it. I'm hot with the spirit. I go with the devil like do. And please, no matter what, never give up. Whatever you do. Sticking and moving like Keanu. Phew, what a relief. I got everything I ever could need. I got a new chance and a new life. I could be anything I want to be. Cause I'm rescued. Never give up. You never know when you'll be rescued. Keep your faith and know that if you do, that God will bless you. If you're breathing, then I promise you there's still potential. Like Miss Peaches from the kennel to the presidential. Whoa, whoa. Look at me go, I got this whole new energy, no enemies, I'm on a roll. I was the one they were talking about when they said to be careful, cause you never know. Treating me like I'm a pit bull, like I'm about to be rude. Nobody thought I would make it, underdog. Came a long way from the basement, thinking back when I was shaking. Thank you, God, now I hold every day sacred. I was the one they were talking about when they asked who let the dogs out. Look at us now, we're rescued, came a long way from the doghouse. Now I got people who love me to death, they all got my back if I'm ever upset. Now I got peace, like Miss Peaches, there's never a threat, one bite. Yeah, everybody knows the rules. I got a whole lot of living to do. For now I'm at home enjoying the view. I got a new life with a big dream. You can see that I'm on the pursuit. Everything we ever wanted is right upon us. I'm a miracle and so are you. No matter what, just keep it moving. Never give up, he'll pull you through. You can go anywhere you wanna go. You can do anything you wanna do. You can go anywhere you wanna go. You can do anything you wanna do. You can go anywhere you wanna go. You can do anything you wanna do. You can go anywhere you wanna go. You can do anything you wanna do. You can go anywhere you wanna go. You can do anything you wanna do.
When you're rescued, found a better dog, a really better ambassador for rescue dogs. So it's like she was put on earth for it, and if she helps another dog get rescued, that's what she's here for. So I really couldn't imagine my life without her now.
Let's give our hands one more time. Mike DiNatale. All right, folks, if you have not had your lunch yet and you are of the color blue, please make your way to the food trucks. Please make your way to the food trucks if you have not had your lunch yet. So I think that's the last color. So if you haven't eaten yet, make your way to the food truck. Make your way to the food truck. Some lines are longer than others. Yes. And for any of you that may not have received a lunch voucher, we have some lunch vouchers available. Please make your way to the registration booth if you have not received a lunch voucher. I know there were some folks that were kind of waiting on that. Please make your way to the registration table where they will have some lunch vouchers available for you. All right. How many of you, hey, where my recovery centers at? How many of y'all ran around like all over the place like chickens with your head cut off, getting to different recovery centers for the recovery challenge? All right. We have a winner today. But before the winner's announced, I'm going to call the team up who produced this, the team up who created it, the team up that is actually keeping track of all the scores. Let's have them come on up. First and foremost, we're going to call Marianne Frangulis. We have Debbie Flynn Gonzalez. We have Corey and Mike from Turning Point and BSAS. And we're going to leave the stage to them. If you are a recovery center, you want to be listening to who won some of this stuff. So first and foremost, the trophy is named after this wonderful creator, wonderful individual, former executive director of MOAR. Let's put our hands together for Marianne Frangulis.
Everyone. I am Marianne Frangulis, a person in long-term recovery, which means for me, I get to be at the 35th MOAR and Recovery Month celebration with you, the visible, vocal, valuable faces and voices of and for recovery. Thank you, Noel and team. Thank you, BSAS, D, Danielle, and team. Thank you, Doris and Bay State. Thank you, board members, sponsors, and volunteers for a beautiful Recovery Month celebration on the Common. And last year, you honored me as I retired from the MOAR executive role with many gifts from all of you, and one was never to end. And that was, I think it's called the Frangoulis Trophy, named after me. Wow, to be given out to the Peer Recovery Support Center that attended the most Recovery Month celebrations. I just so love all 39 recovery support centers, all vibrant in each other, building recovery capital, which all started in what year? 2008. I'm giving you that fact because my new job is Massachusetts Recovery Historian, people. And you will be quizzed. So today, we are going to make history with awarding the Special Recovery Trophy one more time. Hi. And now, I am going to introduce my very good friend and wonderful BSAS Recovery Support Services Coordinator, the one and only Deborah Flynn Gonzalez, who is in charge of this special part. Give it up for Deborah! Yay!
Hello, everybody. My name is Debbie. I am a woman in recovery. I just celebrated my 25th year not long ago. Every day, by the grace of God. Marianne, when you said the thing that never ended, I thought you were going to talk about the song, Sweet Marianne. Don't worry, I do not have my guitar with me today, y'all. So, the Recovery Challenge. It's very fitting we call this award, this trophy, the Marianne Frangoulis Recovery Challenge Award, because Marianne's all about community, collaboration, connection. And that is what we have seen with this Recovery Challenge. It was a challenge that was put forth because, you know, back in the days, we only had a few recovery centers, so we could get together. Then more were popping up, and then COVID happened, and then we were all back in isolation mode. And we needed to do something to be able to connect to each other. And we saw some places were doing that, and then we started putting people together regionally, and they were doing that, and that was great. But we have a whole statewide network of amazing people in all these recovery centers, and y'all want to know each other, right? Whether you're a staff, or whether you're a member, a person that just walked into a center up in the Berkshires and then find yourself for some reason out in Worcester or out on Martha's Vineyard, who knows? You have a place to go. You might have even been there. You know that those are your people, right? In the peer recovery sports centers. So I am thrilled to be able to present this, and we've added some new things to the award too, with some regional awards as well. So right now I want to kick it off to, where did this Recovery Challenge start? You might be wondering. It is the brainchild of our own Corey O'Brien from Turning Point Recovery Center in Walpole. He's being humble, but it really is. And a group of us, and bringing peer process together and the community together to make it even better. And Corey's going to tell you a little bit about why it is so meaningful. Corey.
Hi, everyone. Corey O'Brien, Turning Point, Walpole. I feel like you covered a lot of why it's meaningful, because it's about connection, team building, but most importantly, it's about, seeing that we're part of something bigger than ourselves. Not only do we get to see and make connections about the peer recovery movement throughout the state, like today, we get to see all of one another, which is amazing. But Massachusetts is a national leader in peer recovery. So we are part of something way bigger than ourselves, and that matters so much. So everyone, give yourselves an applause. Thank you all for being here. I also would be remiss if I don't thank Jess, Lisa, and Emily from Bay State for managing the platform. And the other part, there's one thing, I wrote some stuff down, but I haven't read any of it. Oh yeah, it's irrelevant now. So with nothing left to say, but to hand it off to Deb.
Thank you, Corey. Thank you for remembering the big thank yous with Bay State Community Service, who launched this platform. So in case you're wondering, well, what do you mean platform, Recovery Challenge? So all of the recovery centers get points for activities that they do in their centers, in their communities, and then going out to other centers. You get extra bonus points if you go travel further out. This year we had some really awesome new features which were really birthed from the peers themselves when we met and said, what can we do better? Duran is sitting right in front of me. He said, hey, you know those capture the flag kind of competitions? We should do that. Then we get everybody going to new centers, looking under pool tables, trying to find a flag and capturing it, taking a picture. They get points. Hey, how about diversity? What if we have something that honors diversity, an activity that's dedicated to that? And then we added that with points. And then I started seeing on the calendars, and you could see it on the MOAR calendar, all these centers with diversity, cultural lunches, and activities specific to that. So it was fantastic. People going out, I mean, you saw, folks, it would be very common to see someone from the Southeast out in the Berkshires. And that doesn't usually happen, and vice versa. So people are traveling, going outside, and bringing community with them. A lot of people don't know what's available out there. We live in a beautiful state with lots of things happening. So we incorporated the peer participatory process. And part of that, one of the things that was brought up was, what if we are way out in the Berkshires, or we're somewhere that we don't have the resources to go to all these different places? So from that was a competition within the competition, which is the regional winners. So now we're going to announce some very special regional winners. So this means, and this doesn't necessarily mean that they won overall or anything like that. It just means that they got special only points for attending things and activities in their community, in their region. So that would give an opportunity to everybody to win something. But in the end of the day, we're all winners because we made so many great connections and so many fantastic activities. But with no further ado, I'm going to bring up my work partner and colleague, Mike, we're going to do the regional award. So if you're a PRSC and you have a leader of your group, please come up and receive your award. And you can take plenty of pictures afterwards, but we just don't want everyone bumming up. So you can come on up and stay up here, and we'll do a group shot. But send up one representative if you can. That'd be great. Hey, Mike.
Thank you, partner. Deb explained what I was supposed to read out very well, so I don't have to do that either. So my name is Mike Bryant. I am peer recovery support. Thank you. Thank you. I am the peer recovery support coordinator for BSAS for the Southeast, Metro West, and Boston regions. I am going to announce our regional winners, if I can keep it up here. Thank you, partner. And they worked extremely hard over this challenge. And first, I would like to call up, so if you have your team leader, everybody had a team leader for this challenge. If your team leader is present, I don't think this stage will hold up everyone. So if your team leader is present in the region which I call, please send them up. So first region, the Boston region, the winner in that challenge is JP, Jamaica Plain Recovery Support Center. Come on up. If you don't come up in a timely manner, I will give it away. Come on, Holly. Genevieve, let's go. You're an athlete. Skip on up. While they're coming up, I'm going to keep the train moving. In the Metro West region. There you go, Job. There you go, guys. High fives for everybody. Great job. Deb's presenting them. Very good. In the Metro West region, just by beating a fellow center by 10 points, Turning Point Navigators from Walpole, led by Ryan. What's going on there, Sketchy? There you go, buddy. Keeping that train moving along. Central Mass, Ripple Effect, led by Luke. Big Luke, there you go, partner. Good work, bro. Oh. In the Northeast, the bridge is over. The bridge is over. Bye-bye. The bridge in Malden. They're led by Mr. Andrew. Is Andrew Prell? Here he comes. Come on, Andrew. There you go, big fella. Good job, man. You're welcome. In the Western region, once again representing valiantly, led by Miss Sarah. Hope for Holyoke. Come get it. There you go. Great job. And last, but certainly not least, Taunton's own Silver City Bandits, led by Jamie. Let's go. Come on. There you go, pal. Great work.
They were so excited. I love it. Yes. The hard work paid off, but it wasn't even work. It was a pleasure, right? All right. But now, that was great. Fantastic accomplishments. By the way, the order we put them in, that's the order in which their participation was. So Silver City Bandits, Taunton for newbies, man. You guys had great participation. Fantastic. I love it. All right, so right now, this is the moment you've all been waiting for, or a few of you anyway, I don't know. Mary Ann is going to do the honors of opening the envelope with the winner, because it is the Mary Ann Frangulis Award, yes. So it's only fitting that she announced the 2025 winner of the Recovery Challenge. So Mary Ann, it should have come in a suitcase, and but here, it's secure, there you go.
Wow. Oh, my goodness. This is nerve-wracking. All right. I'm pulling it out. I'm pulling it out. I'm pulling it out. And for the second year in a row, the 2025 Recovery Challenge first place winner, peer-to-peer. Congratulations on your outstanding achievement, peer-to-peer. Let's give a cheer for peer-to-peer, to-peer, peer-to-peer, peer-to-peer, peer-to-peer. Where are you, Tom? Tom from peer-to-peer. There he is. That's the guy. He's coming. He's coming. Tommy, 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 Tommy. A cheer for peer-to-peer. Hey, 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 hey. Come on up. There you go. Oh. Wow. Wow. Isn't that wonderful? Big ups. And you, yes. Yes. 2 years in a row. Ho, ho. Fabulous. Are they all visible, vocal, valuable? Victorious! All right.
We're going to get a speech from you or what?
You want to talk?
Do you want one?
Yes.
Can everyone hear me? Okay, so no, just don't mind me. I'm suffering from hunger right now. We got the blue tickets and we still haven't went up yet. However, the moment this is over, we can go indulge in one of these fine food trucks that's out there. I'm certain. No, it's been beautiful. This has been a good year. Notice I didn't say month, I said year, because it's been this entire year, right? Last year, the challenge kind of like catalyzed something, right? It showed us that we had this network of peer recovery support centers out there, and we just continued collaborating. We never stopped. They talk about this recovery-oriented system of care and like how we can have this ripple effect in the lives of other communities. And yeah, shameless plug. But no, it was awesome. You know, we started getting out there, and like this challenge is how we met these people. We met the other leaders in other communities, and we were introduced to these centers that are doing these beautiful things that inspired us to just keep up the good work, the momentum, and all of that. And I don't know if any of you remember, but like about 4 months after the Recovery Month Challenge, 17 centers got together to throw a Star Wars themed rave at the Phoenix building. We had 200 people show up and dress like aliens, and you know, that would not have happened if it wasn't for this challenge. Like, we were able to get into the community and meet the right people and continue to collaborate, and this wouldn't have been possible without the team I have here. I mean, the only thing I did was plug things into an hour calendar. I'm not that special. You know, they accepted all the invites. They went to the events. They did all the things they were supposed to do. And like I said, just don't stop now. You know, just because we're not getting points and, you know, there isn't, you know, a physical reward, you know, at the end of it, there is, you know, a reward that can be everlasting. And that's just spirit of communication, of community, of collaboration, and like, together we can, right? Anyone else?
Hi, I'm Faith from Peer to Peer Recovery Support Center in Fall River. Yes! And I just want to thank all the volunteers from our center that helped us attain this trophy. And we're so proud of everyone. And I want to thank the team as well. And we worked really hard together, took a team effort, and we got the trophy. God bless you and God bless America!
I got nothing after that. Drop the mic. I will not drop it. Yes. Next year's host will be Thomas from Peer to Peer.
Let's give it up one more time for Peer to Peer in Fall River. Hey, everyone. We have some more giveaways. We have some more giveaways. So in my hand, I have a $25 gift card. This gift card was donated from Amore Agape Eres Amado. It's a $25 gift card. So if you're interested in winning, you may need to listen to the numbers that are being called out. We just had someone come up and ask us about a prior number. If you do not come up when I call your number, I can't give you something that's already been given away. So please, if I call your number, come on out. All right, here we go. 4, 8, 5, 3, 1, 0. 3, 1, 0. Four, 8, 5, 3, 1, 0. Going once. Going twice. New number. 484 202 202. Next number 4, 8, 5. 1, 1, 3. 1, 1, 3. Next number. 4, 8, 4. 8, 5, 8. 4, 8, 4. 8, 5, 8. Going once. All right. Next number. 295. Last three numbers, 295. I ain't singing. Where's Mark Muhammad? He don't even know. He got me singing in front of everybody. 485 295. Going once. Going twice. Algun diba. 484 013. 013. 484 013. Going once. Gone. 7, 3, 9. 484 739. Man, I just want to give this thing away now, man. This is getting crazy.
Two more.
All right. All right, I get two more.
Two more.
Four, 484 402.
That's it. That's
402. Last three numbers. Going once. Four, 884. 884. Survey says. Try again. All right. 485. 182. $182 going once. The anticipation. I have a blue ticket in my hand. 485 2 2 3 223. I just want to make sure everybody's hearing me. There could be somebody in line talking about, you read my number. The lucky number from my male Vanna. 485 0, 1, 5. Da, 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 da. Oh. Hold on, what number is that? What's the last name? 4470. All right, we have another gift basket ready to go from Tufts. I'm going to put these in my pocket so they'll stop flying away. All right, here we go. All right. All right, all right. 484977. Nine seven seven. I saw that story too. All right. Hold on. Let's move. All right, peace and blessings. All right. We're going to continue with this. We have a couple other speakers that are going to come and share. We called off as many numbers as we can. We're going to shift real quick. We still have a couple more raffles, so don't go nowhere. But at this time, our next speaker manages RISE programmatic initiatives, bringing over 25 years of experience in health and human service. She previously led Boston's Mayor's Office of Recovery Services and the nation's first municipal recovery office. At this time, let's put our hands together and let's welcome the Chief Program Officer from RISE. Let's welcome Jennifer Tracy.
Thank you. Hello, everyone. What an awesome day. Up to 2,000 people hanging out. I know the sun is bright, but we're super grateful for the weather today. So thanks, everyone that's traveled. Hello, everyone. It is great to be here at Recovery Day. I think this is third decade of Recovery Days that I've been to over the past 25 years. I think I have 2 September babies, so I missed those too, but it's great to be here, and thank you, Noelle. So my name is Jen Tracy, like Noelle said, and I'm here on behalf of my boss, Julie Burns, from RISE Massachusetts Foundation. We are an organization solely dedicated to funding and collaborating on solutions to end the overdose crisis. Thank you, everyone at MOAR, BSAS. I have a lot of colleagues over the years here from BSAS and at MOAR. Appreciate this day always, every year, creating space to come together and celebrate our thriving recovery community. Over the years, watching the recovery centers grow has been unbelievable to watch, and you guys are rocking it. I'd also like to just do a quick shout out to Jamie Davis, who is here somewhere, my colleague, if anyone is still here from Western Mass, recently RISE has hired Liz Wynot and Jamie Davis from Western Mass to make sure that your voices are involved in everything we do, every step of the way. So thank you, and Alana Fusco, who's here as well. Today is a day, and you've heard it all day long, to honor and be grateful for every single one of you, along with your families, service providers, the communities who support us, and to be reminded of our commitment to ensuring all paths to recovery are possible for everyone on this journey, no matter who you are or where you live. RISE is guided by those with lived and living experience and unafraid of new ideas. We build networks, design programming, and support community partners who are using novel approaches to preventing overdose and increasing access to treatment and recovery. And at RISE, we understand that those closest to the issue most often have the best ideas and are often furthest from where decisions are made. Therefore, we strive to share decision-making and power whenever possible with our partners, always centering your voices, the voices of people with lived and living experience. So since last year, we've been working in partnership with the Bureau of Substance Addiction Services on the Mosaic Opioid Recovery Partnership. It's a collaboration designed to get settlement dollars and initiatives to communities that have been historically underserved and have experienced high rates of opioid-related overdose deaths. We have engaged a diverse set of community leaders, healthcare professionals, and people with lived and living experience to inform our process and ensure that these dollars are invested and remain in the communities most deeply impacted by the crisis, while also fueling transformational change through grassroots efforts. I see many of our grantees here today and throughout the day. By the end of this year, we will have distributed close to $13 million in opioid settlement funds to communities across Massachusetts. We have added over 50 grantees this past year through this partnership. And this summer, under the leadership of Liz Wynot, we are excited to expand our efforts to provide training to support cities and towns to help them use their opioid abatement funds to build solutions and strategies rooted in the community and with your voices at the table. We don't need cities and towns buying police cars with opioid settlement dollars. We need your voices and your experience to be part of the process. Please join us to ensure that these dollars are guided by you. Jamie's out there. Get their number. Come up to me. We have a lot of opportunity to have your voice heard in the process. Over 80 individuals this past year have helped us review grants, and we can always use more. So please sign up. We're filled with hope as we continue our work together to drive meaningful change and foster resilience and healing. We're so grateful again to our dear friends at MOAR and BSAS and all of you for organizing this amazing event every year, reminding us that when we lift up our voices and tell our stories and create meaningful connections, we break down stigma and make all paths to recovery possible. Thank you so much. Have a great day and safe trip home.
As you know, we've been raffling things off throughout the day, but there's also been an artist painting throughout the day. And these are two of her paintings that we're going to raffle off as well. Her name is Carly Westmoreland. She's been doing a phenomenal job, and these are actually phenomenal paintings. And we're going to raffle them off as well. So have your tickets ready. Here we go. Yes, we're going to do this one first. If you can't see it, it's a picture of the Parkman Bandstand, and it looks like all of the folks sitting down right there. It's actually a beautiful painting. All right. Ticket numbers, here we go. 484-268. 268. Come on down. Yeah, that was great. Excellent, excellent. She's got the best. I like that one. That one's fire. That painting was fire.
All right, let's go ahead.
Yeah, let's put our hands together.
Thank you. It was 484-268, right?
You had to ask me that now?
I was like, I just wanted to make sure.
Hold on. Now I gotta make.
Yeah.
Now I gotta make sure. I just stuffed it in my pocket. $268. There we go. I need your ticket. Stay here. Let's get a picture together. Oh, pull that ticket out. Actually, don't. That's a pain in the neck. Don't worry about it. I saw the ticket already. Let's get a picture.
Thank you so much.
Excellent, excellent. Congratulations. All right, the next painting is a painting of MOAR. We could if nobody wins. 3 tries and MOAR will keep it. Recovery's real. One more time. All right. 484. 350. 484. 350. Check your tickets. Going once. All right. 485. 234. It's not 234. I sense the anticipation. Ready? Next one. I love this. Everybody's like, what number? Read my number. Last 3 numbers. 0, 5, 9. All right. One more, and we're moving on to another one of our wonderful. After this, and that's the food trucks. Yes. All right. 484 198. Check your tickets. 198. 198. 198. I'm about to get there. Zero 86 485 086. All right. 484 997. Last one, and we're going to move on. Four, 8, 1, 5. I feel threatened. Hey, 7's actually a really good number. 484 933 933. 484142. If y'all ain't reading your tickets, I'm flying through these now.
Let's go. Let's go.
484389. 389. Pa'lante. 484696.
Next.
This is the speed round for real, legit. 485. 321. 321. 484 749. 485 173. Ándale para arriba. 484 220. 220. Oh, yeah, we're flying through this now. Screw that. 484 328. 484 927. 485 239. 485 239. Just want to make sure I read that right. 484 256. What? 485 414. Ándale. Y'all shouting. I'm thinking somebody got it. 484 626. 484 600. I can't hear what she's saying. 485 154. 154. 485 169. 484 664. 484 781. 781. Well, y'all gotta come on, come on. All right, we got two winners coming up. Sube, sube, bang, bang, bang. Bang, 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 bang. 654. Do we have 654 here? I have 239. I have 169. Yeah. No. No. Which one was?
I think they came forward. They deserve to win.
Survey says we move on. The anticipation is bad. 484 238. All right, you know what? We're gonna move on. All right, 484-460. Who's the closest to that number? Oh, shucks. I just put it down. I have 484-460.
Who's closer to 460?
Go ahead. All right. You know what's good? Y'all leaving. Y'all leaving. We got more, though. We got more to raffle off.
Thank you.
Oh, you're welcome. Before we go, though, we do have one more speaker that's coming to speak, and we have two more. Oh, awesome. Fantastic. I didn't know that. Our next speaker is a woman in long-term recovery, the executive director of a location called Ruth's Way, nonprofit sober housing, recovery training and public speaking. She's a certified addictions recovery coach. Let's put our hands together. She's also Massachusetts Alliance for Sober Housing, MASH member board. Let's put our hands together for Nicole O'Brien.
Hi, everyone. So my name is Nicole O'Brien. I am a woman in long-term recovery. My recovery process started in 2007 when I got saved, and it took God a whole year to work on me before I was able to put down a drink. So I'm just grateful to be here today. I'm here, though, not to represent Ruth's Way, which is a nonprofit that I started, but I'm here to represent MASH, the Massachusetts Alliance for Sober Housing, and my notes almost just flew away. All right, so let me tell you a little bit about MASH. Today, MASH has 203 certified sober homes in the state of Massachusetts. MASH exists to promote and oversee ethical management of sober homes based on national standards. And it does this so individuals have an opportunity to heal and get well. You can't, I've never heard that before, but okay. So, all right. So no one in my life has ever said I can't hear you in the back. So, all right, we're good. All right. So MASH is growing all the time, and its purpose is basically to ensure that sober homes comply with a minimum standard based on national standards, to provide a home-like environment that is alcohol and drug-free. From July 2020 through September 2025, MASH was trusted to distribute more than $11 million in vital support to sober houses across the state. That includes over $6.6 million through parole and probation grant, and more than $1.6 million through the Project North, and almost $3 million through the RAP grant, which is the Rental Assistance Program. This funding helps to cover costs for individuals' weekly fees in their recovery housing, to give them an opportunity to get on their feet, to give us an opportunity to secure employment, and to get a couple of paychecks before we have to start paying for ourselves. So whether you're in recovery from substances, trauma, or maybe your own bad attitude, and I'll keep that one with me, you are resilient, you are strong, you are powerful. Recovery happens, we're proof of it, and it's important for us to share our living story, to let other people know it's possible, we're here, we're real, it's not made up. And I just want to thank you for allowing me to share today. Bye.
Let's put our hands together. Let's welcome one more time, Nicole. Awesome. Folks, we have an act that's coming up right now. It's a collective of artists. They utilize their theater, their film, and drama therapy to address the impact of substance use altogether. They build diverse and inclusive communities to promote understanding in the face of stigma. Let's put our hands together and let's welcome Second Act.
Also, the food trucks are now closed. Sorry. Hope you had a lunch.
Thank you. Good. So, it all started with curiosity, you know? Vapes? So what? Maybe it really started with just trying to fit in and not be the kid that everybody else picked on. And then my brother gave me a beer. No big deal, just one. There was this corner at school, the corner kids. Oh, they were the ones who would skip class, they'd smoke, and they'd drink all day. And listen, I wanted to be one of them. Being an outsider was supposed to be cool, so I started skipping class, I started drinking, I was smoking every day, and then one day this kid gave me a pill. I wanted attention, you know? And, you know, maybe the wrong kind, but hey, it was better than being ignored, right? So I started skipping class, I stopped trying, my brain was getting all whacked out. And it got pretty scary sometimes, but hey, I thought maybe this is it, right? This is the secret to being liked. There was a drug for every feeling. You know, mix this, try that, get sick, try again. You know, and it was pretty scary sometimes. But, you know, it got more intense. It did. I stopped taking care of myself. I stopped brushing my teeth. I stopped showering. You know, every day my first thought, where can I get another drink, a pill, a smoke? I was getting really whacked out of my head. I was afraid that people were laughing at me even when I knew that they weren't. And I would have a horrible day if I couldn't find anything, if I didn't have any money. And I was the kid who used to chase fireflies. I was the kid who was chasing a high now. And I stole my grandmother's medication. I blacked out. Thought I was gonna die. And I woke up in rehab, and I was just another kid with a label. An addict.
Hi, Casey. How are you feeling today?
I'm good. Thanks. Who are you?
I'm Erica, your recovery coach. I'm here to help you.
Oh, cool. Great. Yeah, I'm good, though. I don't need help. Never needed help before. I don't need it now.
You don't?
Nope.
So then why are you in treatment?
Me? This is stupid. Just my parents think I need to be here.
Well, you know, your parents did say that you used to enjoy hanging out with your friends and playing music. If it's nothing, then why did you stop doing the things you enjoy?
I don't know, because music's stupid.
Do you really believe that? I'm not so sure if you do. Look, maybe I can help you figure it out. What do you want out of life?
I don't know. Nothing. I don't know.
Okay, what's important to you?
Nothing. Music, I guess. Music and my sister. I care about my sister.
Okay, so if you want to be able to be a big sister and a musician, then something's got to change.
Yeah, my parents.
Maybe your parents have to change, but so do you, Casey. You're the one who's responsible for getting better, but you can't do it alone. You need help.
Well, maybe I don't want help.
Listen, I know it can be hard, but it can also be as simple as making a decision, right? Like decide, just for today, I'm not going to use, right? And then there are a lot of people here to help you if you make that decision. And then tomorrow, you wake up and you decide if you want to do it again.
Well, maybe I don't want to change.
I know it's scary, Casey. But if you ask for help, other people who have done it will help you do it too. Just ask.
Hey, no, don't walk away. What are you doing? No, dude, I can't do this. I don't want to be here. I don't want to be in rehab. No, I need help. I need help. Help! Help! I'm ready. I need help. Ugh.
Okay, we got you. You don't have to do it alone. Told you. Yeah.
I got this part.
Take one step.
So that is just a short sheen from Second Act. My name is Rebecca Harris, and I am the executive director, and I am in long-term recovery. Thank you all for being here, and I really appreciate you sticking it out on this warm day. We are here to support you. We are happy to come to your centers, do a show. We also do drama therapy. So if you need our information, we are secondact.org.
Hi, everyone. Thank you for being here. I just played Casey. My name is Ashley, but I am really a person in long-term recovery. I've been 7 years free from alcohol, and thank you very much. It's really, really amazing to be here. I know everybody recovers differently, but for me, I believe recovering out loud is the way I like to do things. I'm so grateful that Second Act gives me an opportunity to do that. Because today I get to be the person that I was drinking to try to become. I am everything that I wanted to be today, and I'm so grateful for that. And if you are newly in recovery, just know there's so much to life on the other side. Thank you.
Hello, folks. My name is Chris, and I am a woman in long-term recovery. I'm going to try not to cry. Today, I am celebrating 28 years away from a drink or drug substance. And 25 years ago, I performed for Recovery Day when I joined this organization. I've been doing it for 25 years, and it's such a big part of my story. You know, like everybody else, not like everybody else, I drank for a long time. I hated myself when I was a kid. I needed help to figure out like who I was and how I could live a life that was full of hope. And I got that when I got sober. I am so grateful to be here today, and I thank you all for sticking out the warm weather. Thanks.
Thank you so much. One more time for Second Act. I have two more of these wonderful gifts that were put, 3, 4. Oh my God. 4 more. But first and foremost, you know, we always look forward and look to our younger generation. And I think it's really important that we support the younger generation. So I want to call this lovely little young lady up onto the stage. She's sitting in the front. She's been sitting in front for a hot minute, waiting for her number to get ready. Why don't you come up here? Yeah, I'm talking about you. Come on up here. I'm still going to read numbers, so you just could still win one of these other prizes, but I want to give you your very own bag, if you would. But I just want you to tell us who you are. What's your name?
My name is Isabella.
Isabella, thank you so much for coming out here, and thank you for your passion. All right, good job. All right, let's put our hands together one more time for little Isabella. Come on. Now, I have a few more things to raffle, and we're going to blast through this. If you want one of these prizes, I'm going to beg you to do one thing. Pay attention to the number, because I'm flying through them. 485383. Come on, come on, come on. I'm going to have them. Nope.
Oh,
485. 44.
383.
Yeah.
I thought you said the last three numbers.
485383. Yes. 485350. No, I didn't. 484416. 4857. Sorry. I'm about to just start giving some of this stuff up. 485046. Nico, you want to go collect the tickets to these folks that are here? We'll rip them in half and throw them in here.
But there's only one number.
Yeah, that's true. Sorry, guys. I'm trying to think of doing this the fast way. 484608. I know.
Number 8.
484188. 484089. 89. You ain't even looking at your number? All right. Come on. Y'all got to come. Come on. Y'all back there sleeping on us. What number? 089? 089. Come up here and grab whichever one you want. There's 1, 2, 3, 4, 5 different ones here. And it's like Christmas. You can't just open up and look. Just grab one and go. Here you go. I know. All right. Here we go. 484752. 007. 484007. 484005. 006. 006 and 005. 484996. Go ahead. You ain't even looking at your. You have to look at your ticket. 485202. 118. 575. 988. 725. 377. 301. You and me both. I feel like I just aged 10 years. 484, 758. Yes. All right. Whose recovery date is the closest to today?
It's today.
All right. Today, come on. Whichever one. Pick one. Yeah, you're not going to look through them. Just grab one and go. Just grab and go. Just grab and go. There you go. All right. Recovery's real. All right. Hers was today's. Yesterday. 2 days ago. Tuesday. So that was more than 2 days. You're welcome, brother. Whose was yesterday? Come on up. The 24th? That's 2 days ago. Come on up. Pick one.
You in just 1 year? 1 year,
Congratulations. 1 year recovery. Keep on keeping on. Recovery's real. All right. 60 days. Come on, brother. Keep on keeping on. Recovery's real. Recovery days. Come on. Now, this is an honest game, so you know what I mean? At this point, it's just honesty. Your recovery day's tomorrow? All right, pick whichever one you want. And congratulations. No, just pick and go, not peek a peek. So let me ask you this. How long? Keep on keeping on. Recovery's real. All right. Come on. You're going to canoodle with a blanket in there, brother. Folks, thank you guys for sticking out. I know this is kind of weird. I know some of us wanted to get stuff, but listen, it is what it is. Recovery's real. Thank you guys for coming out here. Thank you for celebrating. Thank you for enjoying this day. I hope and pray that you guys continue to uplift and encourage one another. Each one, reach one. Recovery's real. I want to thank all the hard workers, all the volunteers that came out to support this. I want to thank all the staff, all the MOAR staff. I want to thank this wonderful young lady. Her name is Shakia Brittles. Let's put our hands together for Shakia. She worked together with more staff to put this whole entire event together. I want to thank the staff as well, each and every one of you. I want to thank Bay State Community Services. Also, listen, if y'all don't know about this, matter of fact, come on over here. Come on over here. This is my rib. I want to thank God for my rib. I'm glad two people shouted for my rib. If y'all know anything about that, behind every good man is a great woman. And I thank God for her. I thank God for her because I wouldn't be here if it wasn't for her. Recovery's real. Thank you guys for coming out. Enjoy the rest of your day. You're in Boston. Enjoy the rest of the day here at the Commons. Love you guys. Thank you for coming out. The wind is not cooperating any longer. I also want to encourage you guys. We do have a holiday celebration that's going to be going on in December. If you guys enjoy this, come on out to the holiday celebration. Also, if anyone's seen any earbuds or the interpreter microphones, si alguien por ahí se encontró un par de auriculares para los oídos, para escuchar, necesitamos que son dos que faltan. Caballeros y damas, si hablan español, we're missing 2 headsets for the interpreters. If you happen to see them or find them, please bring them to us. What? Somebody lost reading glasses? Oh, somebody lost a pair of reading glasses. Thank you guys for coming out. Good night. God bless. May your souls be at rest. Enjoy the rest of your day.